Unicef says 120,000 children died from AIDS-related causes last year. At least 300,000 children were newly infected with HIV in the same period. UNICEF's latest HIV and AIDS global snapshot warns that the prolonged COVID-19 pandemic is deepening the inequalities that have long driven HIV infection. 2 in 5 children living with HIV do not know their status. Deputy Chief of HIV Programming at UNICEF, Shaffiq Essajee, joins me now from New York to discuss the report further. Shaffiq, thank you so much for joining us. So, 1 child every 2 minutes is infected by HIV. You know, 5 decades we've been fighting this epidemic. That number's awfully high.
It is very high. It's been high, much higher in the past, Tony. Around 2001, it was as high as 500,000 new kids acquiring HIV on an annual basis. So compared to those numbers, we're doing much better than that. But I think the world thinks that HIV, especially HIV in kids, is sort of a done deal. You know, several countries have now eliminated HIV as a vertical transmission issue from mothers to children. And the perception is that pediatric HIV is no longer an important public health priority. And I think what we're trying to show in this report is that that's very far from the case.
I mean, your report, you say significant disruptions in HIV services were experienced due to COVID-19. Just expand a bit on that.
We don't know the exact impact of this, but we do know that at the worst times of the lockdown, something like 50% of pregnant women were not able to attend antenatal care, and that means that they weren't getting tested for HIV, and that means that they weren't receiving the treatments that they need to make sure that they don't pass the infection on to their kids. So the full consequences are yet to be understood and realized, but certainly mothers were not getting treated, children were not getting tested, and that surely means that we will see more infections, and we will also see more mortality and morbidity being caused by HIV in children.
You also state that 15.4 million children lost one or both parents to AIDS-related causes in the past year. Another shocking stat as well. And I'm sure that also, you know, adds to the rising poverty, and abuse of children.
That's actually a cumulative number, Tony. It's what we're saying with that is that since the since the HIV pandemic has begun, we've seen over 15 million kids being orphaned due to HIV. But it's not an insignificant problem. You know, we are still grappling with how to manage those kids. Those are children whose childhoods are essentially stolen from them, and the environment that they're put in with care providers, often in child-headed households, are extremely difficult, and will result in, I think, a generation that, while they're not living with HIV, are affected by HIV and the impact that that's had on their families.
Alarmingly, I mean, you're saying in your report here, as I was just reading in my intro, that 2 in 5 kids do not know their status at all. I mean, I'm looking at in this particular scenario, socioeconomic factors also come into play, I'm sure. I mean, how can a 5-year-old, 10-year-old child even start thinking about that?
Well, that's exactly right. In part, they don't know their status because kids depend on adults, on their carers, to be able to take them for testing and to make sure that they're getting access to services. And the issue there is that if you're testing your child for HIV, you're in a sense testing yourself for HIV if you're the child's mother or father. Because if the child is HIV infected, the implication is that you're very likely to be infected yourself. And I think that's part of the problem that only exacerbates the lack of access that children have. The fact that they rely on adults that have their own anxieties, concerns, prejudices that they bring to the table. The end result is that kids are not getting access to testing. They don't know their status. They're not getting the life-saving medication that they need. And often these children are dying deaths when we don't really even know their HIV status and the fact that HIV was probably the cause of that death in the first place.
I mean, this is a global, report here. Talk to me a little bit about Africa, our numbers at the present moment, especially when it comes to adolescents.
Well, the adolescent numbers are a huge concern. Something like 150,000 new adolescent infections occurring each year globally. A lot of that is amongst adolescent girls and young women, especially for the African continent. We've learned so much about what it is that is driving risk in that population of girls and young women. We know that poverty is a major factor. We know that age, discordant sex between older men and younger women is a very important factor. We know that the lack of education or girls not staying in school is a very important factor that contributes to their vulnerability. And yet I think we're not putting all of this stuff together and saying, right, if we really want to change the trajectory and protect a generation of young women from getting HIV and from the effect that that will have for the rest of their lives on their own health and well-being, we have to take a combination approach. We've got to address the need to stay in school. We've got to provide them with the biomedical interventions that they need to protect themselves. We've got to ensure that families and young women, especially living in extreme poverty, are getting the social assistance they need to be able to change the trajectory of their lives.
Yourselves as UNICEF, how do you get that message across to governments that, maybe they're taking their eye off the ball? I mean, you've got ARVs, one can now live a lot longer and so forth. It's one thing, the population taking their eye off the ball, but, it's almost a responsibility of those governments to keep reminding people that this still is an epidemic.
Absolutely. We try. This is what we do on a daily basis. But I think it's also about communities recognizing that treatment is a right, that children do extremely well, actually, when they get access to treatment. They bounce back, even though they are the most vulnerable because they have the highest mortality when they're living with HIV. They also do the best when they receive treatment that is appropriate for them. And so I think getting that message out to the community and getting the community to say, these are the sorts of things that you should be demanding. You should be accessing testing. You should be asking for treatment for your kids. That's the only way we're going to see change happen, by involving communities, by putting them front and center in the response so that they become part of the solution instead of just waiting for governments and ministries to kind of push down the treatments that are needed by the people.
Shaffiq, thank you so much for joining us this evening. My side, not sure what time it is there in New York, but thank you so much. Deputy Chief of HIV Program at UNICEF there, speaking to us about the report that they brought out today.